Has anyone asked you if you have Sibo? Now, it sounds crazy. It sounds like something out of Star Wars, right? But what it stands for is small intestine bacterial overgrowth. And it's extremely common and it's extremely underdiagnosed. What it essentially is a proliferation of the bacteria in the colon transferring up into the small intestine where it essentially shouldn't be. This causes a massive decrease in nutrient absorption and, of course, a lot of discomfort. So I'm going to dive in and I'm going to tell you a little bit about what the symptoms are and what you can be on the lookout to see if this may be something that you potentially have. So when you have that overgrowth of bacteria in the small intestine, it's going to cause a lot of things. It's going to cause a lot of bloating. So maybe 20 minutes after you eat, you're finding that you're a lot more distended than you ordinarily would be after a big meal. Or maybe you're getting a lot of excess gas that you normally didn't have. Maybe you're feeling some acid reflux. But more importantly, in conjunction with these symptoms, maybe you're feeling some depression, maybe you're feeling some anxiety, because we do have to remember that the intestinal tract and the brain communicate with each other quite a bit. And especially in the case of small intestinal bacterial overgrowth, it really inhibits that communication between the two. So here's how Sibo really works. You see, your small intestine is about 21 feet long. And within those 21 feet, you've got a lot of bacteria. You know, the small intestine is where digestion generally occurs. Basically, the muscles within the small intestine are breaking down food and they're making it so that you can absorb your nutrients. You're absorbing most of your nutrients from your small intestine, not your large. But then you've got your colon, and your colon has a larger number of bacteria than the small intestine because it's got a lot of waste coming through it. So it needs a lot of bacteria to counteract all the waste that's going through. So what happens is you've got these muscles that are moving food along. The muscles are moving food along, but they're also moving the bacteria along. And after you eat a meal and your intestinal tract is empty, sometimes those muscles are still moving. And those muscles will cause bacteria that are in the colon to transfer up into the small intestine where they shouldn't be. Now, when you start getting too much growth there, then it starts making it so that it's over-digesting food, or it's making it difficult for the lymphoid cells to communicate with the immune system. You see, one of the things we have to look out for is in that small intestine, we have a lot of communication with the immune system. So if the lymphatic system is stressed out by too much bacteria that shouldn't be there, then it can cause all kinds of things, like you can get sick a lot more often. But that's also going to contribute to your depression. It's going to contribute to your anxiety. There's a lot more than just intestinal discomfort. Now, you may be thinking this sounds a lot like Candida. We hear about Candida a lot because it's just popular. And I want to be frank with you. Candida is quite overdiagnosed, and I think it's simply because it's easy to just cop out and say it's Candida. But here's the thing, Candida is a lot more in the upper digestive. So you're going to feel a lot more in the way of acid reflux, a lot more in the way of nausea, versus what you would be feeling with Sibo in the terms of the bloating and the intestinal discomfort and possibly the pain, but more importantly, the mental effects as well. At the end of the day, Sibo is a much more concerning disorder that compromises your health a lot more than Candida does. That's not to say Candida isn't bad. If you have that, you definitely want to eliminate it as well. So if you have Sibo, what are you going to do about it? And how do you find out if you really have it? Well, that's the thing. It's one of these diseases that's hard to really diagnose because it's somewhat ambiguous. You know, how can you really guesstimate what's going on? You just have to look at symptoms. I mean, you can't really just easily measure how much bacteria you have in your small intestine. But the symptoms really don't lie. And when they start adding up, you start factoring in the mental component too, a lot of it makes sense. So what will happen if you go to the doctor and they diagnose you is they'll generally put you on a series of heavy antibiotics because they have to sort of wipe you out and start you from scratch so that you can build up the right bacteria again. But in the interim, if you're suffering from some of these symptoms, you can do some basic things at home and see if they help. You can try reducing your refined sugars and your refined carbohydrates dramatically. You see, these help the bacteria grow. Bacteria feeds on the sugar. So we want to reduce that. So try reducing the carbs, try reducing the refined carbs, and see what happens. Additionally, start reducing the amount of fermented foods or fermentable foods like coconut. Because coconut ferments a lot in the digestive system, which can be good for a healthy gut biome, but not for one that has a lot of intestinal overgrowth. So that's the best way that you can start identifying if you have it or not. If by implementing these strategies you feel better, then that's step one. And the next step would be go to the doctor, get on the antibiotic regimen, and get started down the right path. Because remember, if you're not absorbing your nutrients, you can't get what you need to get in the best shape of your life. So as always, keep it locked in here, and I'll see you in the next video.